Hello, my name is Dr. Khaled Zoud. I'm an oral and maxillofacial surgeon with qualifications in dentistry and medicine. I have a passion for zygomatic implants, and I was certified as a ZAGA surgeon approximately 12 months ago. I have been in the sphere and realm of zygomatic implants for approximately 15 years, but once I've learnt the ZAGA technique, it had really accelerated my surgical skills and precision in placement of zygomatic implants. I am also one of the doctors in the only zygomatic centre in Australia, which is located in Sydney, and we provide expertise in the provision of zygomatic implants and full mouth rehabilitation, particularly with very atrophic or very thin upper jaws. We are also a Smile24h Expert Clinic and provide all the services available to patients through that portal. When you receive your new fixed teeth, you will be able to eat, and it will be very, very close to your natural teeth. Nothing will ever replace your natural teeth, but this will be the closest that you will get to being able to eat with teeth that feel like your own. It's vastly different from wearing a full upper denture or a partial denture. This will give you a very, I suppose, as close as possible natural feeling when you're eating. You can taste your food better because the roof of your mouth is not covered by plastic. You don't have plastic extending up under your lips. So it's really the closest we can provide to your natural teeth. After the delivery of your fixed teeth, you will be able to eat food, but you cannot have very hard or crunchy foods for the first 3 months. We need 3 months for your implants and the bone to fuse together, but you can have soft food. For example, you can have pasta, you can have very tender chicken, fish you can have, steamed vegetables, boiled rice. So all of those types of foods are allowed in the first 3 months. After 3 months, you can then eat whatever food you like. Nuts, carrots, all the foods are available to eat after that. In terms of the temperature of food, immediately after your surgery to have your implants placed, if you're still numb from the local anesthetic, you should be avoiding very hot foods because you could potentially burn the mouth. But once the numb feeling has gone from the surgery, you can have hot food or cold food. There's no rules about the type of temperature food you can have at that stage. So some patients are concerned about whether they may gag when they have their new teeth placed. We don't find that this is a problem when you have fixed teeth. A lot of patients are concerned about this because maybe they were gagging when they were wearing their full removable dentures, but when you have fixed teeth, they're a lot smaller, they don't extend to the back of the throat, they don't cover the roof of the mouth. So a lot of patients who have this type of treatment is to stop them from gagging when they were gagging with their removable teeth. So we don't find this as an issue. So a lot of our patients want to know what can they eat straight after the procedure. Usually we tell them avoid hard crunchy foods like nuts and carrots, raw apples, but pretty much all other foods are okay to eat. One good analogy is we say if you can cut food with the side of a fork, then that food is okay to eat. But you know, if you're like Middle Eastern food, hummus is very nice, baba ghanoush is very nice, pastas are very good. If you're from the subcontinent, India, you can have curries, boiled rice. So there's lots of foods you can find that would be suitable irrespective of which culture and what foods you like. During the first week after surgery, really I would still stick to softish foods. I wouldn't go into the very hard, crunchy foods. They can be managed at approximately 3 months after your surgery and after your teeth have been in the mouth and once the implants have fused with the bone. Then you can pretty much go back to a very normal diet.